I feel the reasons for our nomination have very much been our focus on patients and the demonstrable success that the project has brought to patient safety and to the improved inpatient experience. Our work has been very complex and challenging, and indeed continues to be very complex. I would hope that our nomination stood out very much because of the impact that the work we undertook had on patients, because I do think that's really the most important aspect of what we were doing. I also think there was great honesty within the nomination, that we were comfortable to talk about issues such as value for money, particularly around our consultant workforce. I would hope also that the creative approach we took, the very visual nature of the work we did came through, and also that the resilience and hard work and commitment of the whole team came through. My journey as a leader in the NHS has started as a clinical radiographer, and I've worked at a senior level in clinical radiography and really enjoyed the opportunity to influence clinical care for patients. In stepping into radiology management, and this is my first management post, it's given me the opportunity to really broaden my scope of influence, and I would hope I've used that to good use to really influence a number of services and really drive standards up for patients. I put my success as a leader down to hard work and commitment, and therefore to some of my own skills and abilities, but very much to the environments within which I work. Very fortunate that we have a culture at South Manchester that's open and honest and encourages the difficult to be done. I think what I've achieved over the last 12 to 18 months has been to support and lead our team in radiology to massively improve patient outcome by really improving the turnaround times for their diagnostic results to be available to them. That's been done not just by practical improvements or by improving process, but it's also been about working with the team to change team dynamics and culture, and really developing a vision and a belief that we can be a really positive team whereby we see challenges as opportunities.
Most of the nominations based around research, and what we've succeeded in doing is achieving targets both in terms of finance, targets in terms of the quality of the trials we produced, and also obviously quality in terms of the way in which they've increased the number of referrals that the Trust has received as a result of the profile of the research as well. As a comment, a 50% increase of the referrals to our Trust. We've had a 10 times increase in the amount of recruitment for clinical trials over the last couple of years, and certainly at one point we represented a very sizable fraction, possibly as much as a fifth of the total local research recruitment for the Merseyside and Cheshire region. I think my nomination stood out because I was able to use the skills I've acquired in leadership over the years to collaborate to get the research off the ground. So ultimately, the nomination was about a collaboration between the NHS, the commercial sector and the third sector in terms of developing research within a trust. My success as a leader, I think, really has been around my communication skills, which I've acquired over many years, both as a clinician within my own field, but also operating within the very specific and structured leadership organisation within the Five Boroughs Partnership. And this particularly has enabled me to build up a lot of close working relationships with a very diverse group of people. Clearly, I would like to use this as a springboard to go further and to develop myself both further as a leader, but also to develop the research agenda, first of all within my own trust, the Five Boroughs Partnership, but across Merseyside and Cheshire, and hopefully across the northwest of England. Clearly, I mean, the current government envisage a sort of a more localised approach to delivering services. And one of the things we found here particularly is that we've been able to incorporate clinical research practice into clinical practice much quicker. That's improved our clinical practices. We've also had to work very closely with our service users as well, and we've basically been able to incorporate research practices into clinical practice much quicker than would normally happen, and that's got to be good in terms of patient care and safety. When I was a medical student, I was appalled at the way in which dementia was a neglected branch of psychiatry, and that was 25 years ago. And over the last 25 years, I've been able to take part in making that change, really, where there's now a lot of research done on dementia. The understanding of the disease has improved enormously. It's enabled me to work closely with the commercial and the third sector. As you know, the Prime Minister himself has made it a national priority to improve research and commitment to dementia.
When I was nominated for the awards, I felt incredibly humbled and privileged, and I was also incredibly pleased that safeguarding is being put on that agenda, and sometimes safeguarding gets forgotten, and I was just really, really pleased that that topic is being recognised. The reasons for my nomination are around starting to develop the role around Head of Safeguarding at Liverpool Women's NHS Foundation Trust, in recognising vulnerable patients and putting safeguarding at the top of the agenda, and looking towards developing training programmes and broadening partnership work with other agencies around the safeguarding agenda. I put my success as a leader down to recognising how it feels for staff and patients to be delivering care. I recognise that safeguarding is a very difficult topic. It's something that quite often people feel very frightened of, and it's breaking down those barriers. So it's making accessing safeguarding services accessible for everybody and taking away that fear and that trepidation that exists. The reason for my nomination is around developing a safeguarding training package for staff. It's around developing links with partner agencies to strengthen our work in safeguarding and giving a voice to vulnerable patients.